Welcome to the Birth Squad podcast. If you're riding with the squad,
hey fam,
and if you're new,
welcome to the squad. We're your hosts, Dr. Ijama Okwando and Dr. Kanisha Thomas. We're two licensed obstetrician and gynecologists, as well as best friends.
The Birth Squad is a podcast for birthing individuals by two Black female physicians who use stories from real women to educate about pregnancy, birth experiences, reproductive health, and all things in between.
And while we hope that you love learning from our podcast, it is not intended to be a substitute for medical advice, diagnosis, or treatment. So please consult your healthcare provider for your specific care. And to learn more about us and about the podcast, please follow us on Instagram at The Birth Squad. And also check out our website, thebirthsquad.com.
Please keep in mind that some of our episodes may cover topics that could be triggering to some individuals. Listener discretion is advised. Well, welcome back to the Birth Squad. We are super excited today. Ijama and I have a very good friend that is joining us that we've known for many, many, many years. She's seen us through thick and thin, right? When we were stories that we probably can't share.
Mm-hmm. Yes.
Yeah. But we're so happy to have her, Dr. Griselda Reyes. We would love for you to start by introducing yourself and then sharing a little bit about your background.
Sure thing. Well, it is an honor and privilege to know both of you and to have walked through some rough patches and be on the other side of it for the most part. I just wanted to start out by saying that I love you both, and I'm super proud to call you friends and fellow colleagues. I'm not going to tear up yet. Okay. My background is that I am a daughter of immigrant parents from Mexico and El Salvador. I grew up with my mom and my younger brother, so she was a single parent in San Francisco proper, in the city, very inner city, mostly the Mission District. And then I went to public schools, went to UC Berkeley for undergrad. That's where I met y'all. And then didn't know if I wanted to do medical school, took a little break, decided to go for it, went to medical school at UCSF, and then decided to do OBGYN residency, and I matched at UCI, which I loved. I then graduated, spent some time at Long Beach Memorial, another hospital that I care deeply about, and now I'm back at UCI working as a hospitalist. So obstetrician hospitalist with a little bit of GYN surgery. I live in Orange County, and I have two twin boys and a wonderful husband and wonderful family. And yeah, just trying to help, the next generation of OBGYNs and help mamas, through this journey.
Your path to motherhood.
Yes. I honestly didn't think I wanted kids until after 25, maybe when I was 28. So I took care of enough, nieces and nephews and cousins and stuff like that growing up that I was like, I'm fulfilled. I have enough, but I decided that I did want my own kids when I was about 28. But that was in the middle of medical school, and I knew that I could not handle that. And to everyone that is able to handle that journey, my respects, because it is tough. So we decided to wait until about, the second half of residency. So a 4-year residency, second half. And we were very fortunate to not have to struggle too much to get pregnant. As you both know, infertility rates in, physicians is a problem. And I feel like in OBGYN, I don't know the stats for OBGYN, but I imagine it's the same, if not worse. Excuse me, let me shut off that. So we got pregnant, and I was convinced that, it was going to be easy and straightforward. But then we found out we were having twins.
Can you tell us a little bit more about that? Like, What was your experience discovering you were having twins? How did you initially feel? What concerns and fears were going through your mind?
Yeah, so I missed my period and I wanted to wait to get seen until about 9 weeks because as physicians, unfortunately, we see the awesome side of this field, but we also see patients who come in with miscarriages, and I just didn't want to go in to get bad news. So I think that kept me from getting seen as early as possible. So I made an appointment to get seen, and I was about 9 weeks at the time. And all I knew was that since the day that I missed my period, I was super sick. I was extremely nauseous. And I said, oh my gosh, I'm just such a wimp. Like, if all my patients have to go through this, like severe nausea, severe vomiting, I I can't even hang. But we got in to see the doctor. I almost told my husband, maybe you should sit this one out. I don't know what we're going to find out. But he said, no, I think it's important that I come to your first appointment. And so I was like, I just didn't want him to see any bad news if it was going to be bad news. And so we get there, we get an ultrasound. This is a transvaginal ultrasound. Um, and the doctor says, who I know, she's like, wait a minute, I see a second heartbeat. And the first thing I said is, oh no. And then the next thing she said is that I can't really see a membrane, which meant that potentially these were going to be twins that shared not only the placenta, but the same sac. And so I immediately stood up while still having the ultrasound being done. And I was determined to find the membrane. And we found the membrane, and that was great news. But we were both in shock. We were not prepared. Neither one of us, even though there's twins on both sides of our family, we were not prepared. Yeah.
So you were kind of going through the reason why you wanted to make sure there was a membrane. Why was that so important?
So when you have twins that share both a placenta and a sac, there's nothing separating them, which means that their umbilical cords could possibly become entangled at some point during the pregnancy, which can lead to losing one or both, or having, constriction of one of the umbilical cords, which can lead to lots of problems, lots of different kinds of problems that I don't want to scare people out. But, um, you know, and I was in my fourth year of training. So I think all of those things were quite fresh. I was seeing patients that had those types of pregnancies that were admitted to the hospital for weeks on end in our antepartum unit. And I just did not want to be one of those people. I did not I wanted the least complicated pregnancy possible.
Right? So I know you wanted the
Right.
least complicated pregnancy possible, but inherently, just by having twins, you were classified as high risk. Was there anything else specific about your pregnancy, um, that made it that you encountered any complications or, you know, um, high riskness?
Feature. Hmm.
Yeah.
Hmm. Yes. I got super lucky with monodi, monochorionic diamniotic twins, which is what I had. So one placenta, two sacs. You still have a risk of a couple of things. One of them being twin to twin transfusion syndrome, which required us to get a lot of extra ultrasounds early on. Also, it being a twin pregnancy, we wanted to make sure to get the cervical length checked. So it was just a lot of extra ultrasounds and then testing to see if any of those things would develop. And we were so lucky that none of that happened, not even preterm labor. I did develop preeclampsia. I got diagnosed around 35 weeks, but it was not the severe kind. So I had to stop working at that point and stayed at home for about the last 2 weeks and got to deliver. Went in for an induction at 36 weeks and 6 days, and then we delivered right at 37 weeks and 0 days via C-section, which was also not planned. We were trying to have the twins naturally.
I mean, you talked about a few of these things, needing extra ultrasounds, needing to be off of work for a couple weeks. how did your, like, who's a part of your healthcare team when you have twins? How did they manage your pregnancy? Can you just kind of walk someone who might not know what that looks like through that
Yeah,
a little bit?
absolutely. Yes, absolutely. So immediately after we found out that there was two embryos in there, I no longer could see the same doctor that I started out with. I had to get transferred to a perinatologist or a maternal fetal medicine specialist. Luckily, because I got to train with them, I got to um, be with uh, an MFM is the abbreviation that we use that I really trust. His name's Dr. Srivastava. He's excellent. He specializes in taking care of women who have placenta accreta spectrum issues or placentation issues in their pregnancy. And I got to see him. So he became my primary obstetrician at that point. And then he worked with a nurse practitioner who would see me in between. So maybe around every 3 weeks or so. And then I would have ultrasounds around every 2 weeks. He was quite conservative. And I think, it may have been because he also, was my attending and just wanted and knew how hard we worked as residents. So wanted to keep closer tabs. Um, in addition, several other patients that were in similar shoes as I was, I got to meet a few, and they had as part of their team a doula. I did not have my own doula, but I think in hindsight, it could have been really useful, especially in the early postpartum period. So that's something that if there are moms out there that are pregnant with twins, I would highly consider either a postpartum doula or a night nurse, just to help you get through those first couple weeks. I don't know, did that answer the question? I hope.
Absolutely.
Okay.
And then for those who don't know, Grisella used to be a doula.
Yes, that's right. So I kind of doulaed myself. That's true.
That's
I
fair.
don't recommend, but but yeah,
So
we
you
were
talked
busy. We were
about
both busy.
you talked about your delivery, right? You had an induction at 36 and 6. Babies were delivered at 37. So it sounds like, it was an unexpected mode of delivery. So can you tell us a little bit about the circumstances surrounding the delivery and like what did you experience leading up to it?
Yes. I have to say that I love the hospital that I delivered at, because the nurses are used to taking care of patients that are quite sick. Um, and that just made me feel comfortable because I knew that even if I was going to deliver by C-section, I was going to be, I felt like I was going to be okay. Um, and I also wanted to try to have the twins naturally because I've had the fortune of being able to deliver twins naturally, um, those that are monodi twins as well. And I wanted to avoid major abdominal surgery if possible, but we we got as far as about 7 centimeters, and then I just stopped dilating. I just spent maybe like 12 hours. We really stretched it. We really tried, but at that point, twin A, or his name is Ezra now, um, he was not loving being in the labor process anymore. And then we had, unfortunately, he had a bradycardia that led us to have to rush to the OR. But luckily, I was in a room that was close to the OR. My nurses and my team helped keep me calm, and obviously, it does help that we do this every day. So I just try to stay as calm as I could. But it was nerve wracking, like being on the other side of the drape. I was hoping that by the time we got from the labor room to the operating room, the heart rate would come back up, which is what sometimes happens, and we're able to help patients avoid a C-section that way. But we put the baby back on the monitor. Baby was still down in the 70s. So 70 beats per minute is too low. Um, and so another thing that happened is that unfortunately my epidural was not taking to the level that it needed to for the C-section that needed to happen immediately. So I was given ketamine, and so I was C-sectioned, and I wasn't asleep, but I didn't remember, most of the surgery. because it's a dissociative drug, and you go to another place, in a sense. And so I trusted the team, and I knew that they, had to do what they had to do. And we thought that that might be a possibility, but, um, until you go through it, you don't really, you can't really understand what it's going to be like. I think really important is to, trust the team that you're with and ask the questions that you have, um, beforehand, like what would happen if this happened, or what would happen if we went to C-section, or if the epidural didn't work, so that way, at least before anything happens, you're a little bit more comfortable, um, knowing what could happen. And I think being an OBGYN helped me stay calm, um, throughout it. And then we had the babies, and luckily, after that, things went pretty smoothly for them. They didn't have to spend any time in the NICU. Um, they didn't have to, stay to get any extra treatment. I developed severe preeclampsia afterward, and so had to get extra treatment for that. And that was crummy, but I'd say about day two, things started to feel better. But I do wish, that we had had an extra person, um, there, maybe my mom, or my husband's mom. But we got to come home on post-op day two, and then we started there. We started that journey there.
So when you look back on your experience, you and Julian, what do you like? How do you feel about, like, what emotions kind of come up when you think about the birth, and the postpartum period? What goes through your mind? Like, did you guys debrief it at all? Like, what do you think?
Yeah, I think, I should say also that my husband is also a physician, which was really helpful because I can't imagine having to explain to a partner that is not, medically trained, or at least even just familiar with the medical field, all that went on. And even as a physician, we had to talk about like what happened and sort of do a replay. And he had to tell me, this is what happened, you know, baby came out crying, and I'm sad that I missed that. But at the same time, I'm happy that the team did what they had to do to get them out as quickly as possible. Um, because the trade-off would have been, okay, maybe they didn't put me on ketamine, and maybe they would have waited for the epidural to be at a level that it needed to be, and then I could have been conscious for their first cry or whatever. But I knew that I didn't want to compromise their health for that. And so, um, he was able to tell me, like, that yes, they cried, one of them looked a little bit pale, the other one looked nice and red, and but they were both hungry. And so I think that a part of me will always miss that. But I'm happy that the team got them out as quickly as they did, and that they had no time in the NICU. They didn't have to spend any extra time in the hospital. Um, yeah, I think that it is a shock to the body that you don't recognize because you're kind of in survival mode. You're just focused on, like, I have to start breastfeeding. I have to figure them out as babies. I have to update our family, so you go kind of into mama mode immediately. And um, and that was hard because you kind of set all your emotions aside, or at least I did, um, to just start, being a mom. Um, but Julian was really great throughout it all. I think he knows kids too. That also really helped. Like, he was really good with babies. He's a pediatric neurologist. I'm just gonna say it. And so that was, I feel like, another layer of comfort that I wish everybody else could have too.
UIN, you had prior knowledge about having a twin pregnancy, delivering twins. Um, but is there anything, now that you've experienced it yourself personally, is there anything you wish you had known beforehand?
Oh my God, how hard breastfeeding is. Some people have an easy time breastfeeding. A lot of us don't. A lot of us don't. It was a real big challenge for me. And just talking with moms who were in the same boat as I was at the time, and just seeing what profound effect it can have on your mental health, on your mood, on your energy levels, on your confidence as a mom, on all of that. I think that one thing we can do better for our sisters and just anyone that's going through that is make sure that they're feeling supported if they're struggling with breastfeeding, because it it's a full-time job. It truly is a full-time job. And I feel like we do get some pressure to breastfeed, as a society now, at least not when we were babies. My mom was encouraged to give formula, when I was a baby. So that's different. And I think it's okay to stop breastfeeding when it's not helping your mental health. And that was another thing I really do have to thank my husband for, is that he was brave enough to be like, hey, it's okay if you want to stop. Um, because again, when you're breastfeeding, when you're going through it, all you want is to provide for your babies and to give them the breast milk, as much breast milk as you can, right? And so I always had to supplement because I never made enough for both of their appetites. They continue to have strong appetites.
Talk
Um,
about that a little bit, like having twins is a big deal. Everybody glorifies it like, oh my God, I have twins. I want twins. But like, talk about that. Like, what are some of the challenges that you faced having twins? And it doesn't have to be during pregnancy or delivery but like in general, like what are some of
yes,
the hard things you face having a twin?
yes, especially for, I think some people are just really great with kids. They understand kids, they speak baby. And I had the fortune of coming across, a couple of wonderful nannies who really spoke baby and were a godsend. Um, but when it's just you and your twins and you're by yourself, which again, I had a lot of support, but when it was just me and the twins and they're both crying at the same time and they both need the same thing at the same time, and you have to choose who is going to get your attention first, that is something I don't think I was ready for. And it still happens, but now I'm more comfortable knowing that, you know what, like they're safe, they're loved, they're not alone, and I'm gonna get to them in a second. But when you're in that situation, they're both crying, they harmonize, and the cry gets even louder, and you're tired, and you want to cry. That is quite stressful. And I think that other twin moms, I think it's something that moms that have babies that are twins or multiples or close, very close in age, um, get a lot. And I think it does. You have to find a way to unwind, from that, because your anxiety level goes up, and it can stay up there. You don't even recognize it because now you're doing laundry, or now you're washing pump parts, or just managing. Um, that's really hard. Um, the other aspect I would say is hard is like, are they each getting enough attention? Am I giving them each the individual attention that they need to develop appropriately? Um, and that I still have that question sometimes, but I think finding good support is super important. And if you're not good at that already, then welcome to welcome to the club. But you really have to try. I hope that you would try to start getting your support system in place if you're pregnant with twins now. Just, if your parents are not able to, really be there, or start trying to find some support. There's twins clubs, like twin mom clubs too, that you can join. And I just felt kind of overwhelmed, and I was like, I can't join another thing. I can't have another commitment, but I really wish I would have tried it, to see if there were other twin moms that could help or had the bandwidth to help. Those are some of the things. On the flip side, it's amazing to have them. It's amazing to witness their bond. And it's something that they share that relationship with one another and nobody else does. So that's really nice to be able to see them do their twin talk and not have any idea what they're saying, but they'll always be bonded that way. They've shared a room, their whole life. They've shared a womb. And so that's really cool. I think it is definitely worth it. So I would say, if I could go back, would I choose twins again? Yes, I would. But I would also get a lot more support people to help me. And I think people like us tend to just want to just do it on our own, or we are particular and we have specific ways we want things done. But I think letting go and recognizing that it may not be done exactly the way you want it to be done, but you also need to rest and take care of yourself so that you can be a caretaker. Um, that was long-winded, but I think that was a good question because it doesn't often get asked.
Next question was like, is there any advice that you would give to someone who is anticipating having a twin pregnancy? And sometimes twin pregnancies do end up as a preterm delivery. So any advice
Yes.
other than what you've already offered, which has been great?
Yes. I would say, especially if you're going to give birth preterm, and you anticipate having a NICU stay, asking your NICU if they have other parents that can come talk to you that are there that have been there for a little bit longer to help you sort of navigate that, because I've had patients and I've also had friends and colleagues that have ended up spending time in the NICU, and it's really rough. Um, you can't really sleep very well. Sometimes there's not a place for you to sleep, so you have to sit there as a mom, as a new mom. All you want to do is be by your baby's side. So that can be really rough on your mental health, or can be really, really challenging. You know, Having to be out of work for longer than anticipated can be really rough. So there's a lot more challenges to spending time in the NICU that I can speak to, but I would say, having good communication with your family and recognizing that you're not going to know what you're not going to know. You have to have, I would say, a lot of grace, give a lot of grace to your family and to yourself that you need help. And you may not even know what kind of help you need, but there are always social workers there, and other families that you should be talking to, at least while you're in house, that can provide support for you. Other advice I would give, also with the breastfeeding, there are lactation consultants that work at the hospital and that should be coming by to check on you and see how it's going. And if you don't feel super confident, there are other programs that are available, either paid or through the government, that you can access to get help. So I ended up doing, like, for the first 3 weeks of their life, I would go in like twice a week. It was an in-person lactation visit where they would literally help them latch. And I would take one twin one day and the other twin the next day. That was a whole nother thing. But but it was really helpful because these are often people who have gone through it with many families. And you really just need that. You need people that have gone through it before you, um, that can help guide you. And then I think one thing I didn't do is that I wish I would have done was to, a couple of weeks in, just do one thing for myself, like one thing that is not related to being a mom or being a doctor or whatever profession you're in, that is just you, so that you don't lose yourself. Um, because postpartum depression and anxiety are real, and you need to find some way to just relax, as much as you can. And you're not going to want to. You're going to want to just be at your baby's side. You're going to want to be a mom like 100% of the time sometimes, but you should also try to do something that's not related to anything except for just you. Even if it's like for an hour a week, if you know, I would say that. I'm trying to think of what else. Doulas are awesome. So we ended up having a night nurse or a night nanny come when they were about 4 months old, because that was like peak sleep deprivation for me. They weren't night trained, or like they weren't sleep trained yet at that point, and 4 months of sleep deprivation plus finishing residency and taking boards and all that, it just all accumulated. And so again, my husband like knows me, and um, we agreed that it was going to be good for everyone, for for someone to come in so that I didn't have to wake up at night um, to feed them, and I could just get a solid 6 hour sleep. Um, yeah, it for those that are not used to sleep deprivation, I think with twins it's a little bit harder. So I would also recommend putting the twins on a schedule. And it's not gonna be cute or fun to have to wake up one of the twins to feed them when they look so peaceful and angelic just sleeping there. You're like, why would I wake them up? But if you don't put them on a schedule whereby you're feeding them at the same time or like back to back, you're never gonna get sleep. Sleep's gonna be really hard. Um, and I'm really happy that we did that. And I'm also happy that we sleep train them. We sleep train them at around 5 months, and it's not for everyone. And you know, I, we tried the just the cry it out method, and that was really hard because I would have to physically leave, and my husband had to do it because I couldn't handle the crying. Um, and but they did it, and they're fine. I don't think that they're psychologically scarred from it. But that's not for everyone, and I can totally understand how it, like, if someone doesn't have the support that they need to do that, that why they wouldn't do it. If I was by myself with the twins, I probably wouldn't have done it. But it did really well for both of our mental health that we could get them to sleep through the night. Um, I have friends that whose babies, still kind of don't sleep through the night, and they're older, and it sounds really, really rough. Right now, unless they're sick or something else is going on, a big change, they sleep through the night, and I'm so grateful. That was a lot. That was a lot,
No,
but
so helpful. So,
Good
so
advice.
helpful.
So many good
Yeah.
pearls.
yeah,
If you had to think about someone who had a C-section, what advice would you have about that? Like, have you thought about, is this it? Or are you guys going to have more? And if you are thinking more, would you do another C-section or would you try to have a vaginal delivery?
that's a wonderful question. Um, we haven't decided yes or no. I think on some days it's maybe, other days it's absolutely not, and other days it's like, oh, that would be so nice. So I don't think that the door's completely shut, but I'm super happy with that, with what I have, this beautiful family that I've been blessed with. So if it just stopped there, I would be perfectly fine with that. That's one other thing I missed. So if you end up having a C-section, whether or not had just one baby or two or three or however many, um, it is major abdominal surgery. And I tell that to my patients all the time, and I kind of just stop in my tracks to make sure that they know this is a big deal. Yes, it is the most common surgery. However, it is a big deal. And I think when you're a first time mom, you don't care. You care about your baby, and you want to be getting up, and you want to be feeding them, and just being the mom that you thought you would be. And you are recovering from major surgery. So what I tell my moms that I didn't do, and I ended up actually having an infection at my wound site, or at my incision, because I ignored my own advice. I just, after a couple of days, I was like, oh, it's fine. And I ignored it. Um, I would say that as a new mom, if you have the support, all you should be doing is sleeping, eating, feeding the baby, cuddling your baby, and taking a shower when you feel like it. and that's about it. Everyone else can help with the diapers, help with meals, help clean the house, help do bills, and all of that other stuff. And I had the support, but I felt compelled to be the one to get up, to change diapers, and, do a lot more extra stuff than I should have. I should have just sat down. And so maybe if you're like me and that's your kind of style, like you can't sit still, just maybe take it down a couple notches. Maybe do 50% of what you would originally want to do and be okay with the fact that no, you're not going to be able to do all the things you want to do. But it's for a limited time and no one's going to judge you, and you need to recuperate from major surgery so that you can do all the things you want to do. It's way easier said than done. Um, take care of your incision, make sure it's nice and dry, clean and dry. Um, Moist environments and dark environments breed infection. So you want to air your incision if you need to, if you have the belly hang or belly overhang. Um, yeah, I think it's super important to remember that you had major abdominal surgery. Yeah, and try to heal it. Try to remember that as you're trying to figure out how to breastfeed and change diapers and all that.
I think you
There
brought
was
up.
a second part of the question. Did I don't know if I hit the second part, but
You toe lack.
Oh
oh,
yeah,
yes,
question.
most definitely, yes. So if we had another pregnancy and whether or not I would want a repeat C-section versus trying vaginal, um, I would try to have, and the baby's head was down and everything, I would definitely try to have vaginal delivery because the recovery is just, obviously I see it every day. I know that it's possible as long as you do it in a hospital that supports and is equipped to handle um, a TOLAC or a trial of labor after C-section. That I definitely would recommend. Now, if I knew for a fact that I wanted to have my tubes tied and and I don't necessarily want to, everyone's different. If you do, then I would maybe consider having a repeat C-section and a bilateral tubal ligation at the time of that surgery, just because it would save me a surgery. Yeah, I think people are different, and I just having had a lot of patients, have successful, have VBACs or have vaginal births after C-section. It's just, it would be really nice to have that recuperation rather than another C-section because I don't know what scar tissue is present there. I don't know how complicated my repeat C-section would be. So I would definitely want to try. That's a good question.
Great. Yeah. Is there anything else that you want to share with the birth squad?
Yes, y'all are doing an amazing work. And I hope that your listeners know how thoughtful and intentional you are. I hope that you continue to highlight that people are experts of their own stories and their own bodies. That's really refreshing because um, it's so needed. We do need to remind people that they have the control, and that they have inside of them all that they need, in so many ways. And I think that um, keep I don't know, just keep having that same spirit. Um, Same for moms out there, and same for people that want to get pregnant or have families. Like, you just need a little bit of support. Don't do it alone. You can do it alone, but it's really hard. It's really, really hard to do it alone. So don't do it alone. Don't be afraid to ask questions. Try to enjoy it. Um, That was one other thing that I wish I would have enjoyed my pregnancy a little bit more, but I was so kind of stressed about what could happen. So even if you do like a maternity photo shoot on your iPhone or on your own phone, you know, look it up on YouTube. It's very easy to do. If you're too busy to have like a full on, ocean side photo shoot, if that's not going to work, just do something small to enjoy it. Enjoy, even if it's hard, even if it's a really complicated pregnancy. Like, there are positive and joyful aspects. in the struggle. Yeah, I think that's all I have to say. It was a lot, but I hope it's helpful. And if anyone has questions, I'm happy to be reached by email, especially for moms out there pregnant with twins. Um, yeah, I'm in the timeline to get back to you would be like a week or two because my boys are still small, but I will definitely get back to you.
Can you share that email? Do you want us to put it in the
Yeah, I
subject?
think that'd be easier because
Okay.
yeah, it's my first name, last name, MD at Gmail, but it's easier to see it written out. So yeah,
Yes,
yeah.
we will
Oh,
definitely include that in the
yeah.
show notes. Thank you so much,
Awesome.
Griselda. You're amazing. Like,
You
just,
guys are amazing too.
you're sharing your experiences and the work that you're doing as an OBGYN too. You're really making an impact and a difference, just by virtue of who you are
Yeah.
and where you came from.
Yeah.
So I love that.
Yes,
Thank you
thank
for
you.
saying that. Thank you for having me. I just am so excited for y'all. I can't wait to see what happens in the next few years. And yeah, and I love that these platforms exist and that people can have a little bit more information going in. So I applaud your work. Please keep doing it.
Oh, thank you. We love
Me
you so
too.
much.
Yay, we did it. Yeah.
That's the wrap of this episode of The Birth Squad.
Thank you so much for joining us this week. We are going to continue sharing stories from more badass birth warriors because at the end of the day, you are the experts of your experience. And we want to highlight you and your bold, brave, and beautiful journey to motherhood.
And we want to hear from you. Tell us about what topics you'd like to hear more about. Hit us up on Instagram at The Birth Squad and check out our website, thebirthsquad.com.
Most importantly, be sure to share this episode with your squad.
Until next time, I'm Dr. Ijama Ogwandu.
And I'm Dr. Kamisha Thomas.
Peace, love, and solidarity from the Birth Squad.